Each year, 1 in 11,000 babies is born with a disease called spinal muscular atrophy, a devastating disorder that changes the life of a family. Parent advocate Regina Phillips and Dr. Shamindra Connersman are here with important information. Thank you both so much for joining me. And Regina, we'll get to your story here in just a little bit. But Doctor, starting with you, what are the signs and symptoms of SMA and how are patients diagnosed?
SMA is a rare genetic neurological condition that results in the deterioration of nerves over time. The most common symptoms are difficulties moving the arms and legs, difficulties swallowing, and difficulties feeding. The difficulty moving arms and legs can actually result in paralysis, and in some patients, mostly infants, they may never achieve their next developmental milestone. For example, a baby may never sit on time. It is also possible for a child to lose their developmental milestones. So they may lose the ability to sit, for example. The proper way to diagnose this condition is a neurological examination followed by a gene test. Because it is a devastating neurological condition, it needs to be diagnosed through a genetic test.
Right, and the word devastating just keeps popping up because it really is difficult for any family. Regina, describe your family's journey and diagnosis through treatment.
Sure. So my family lives in New Jersey, and newborn screening is not on, SMA is not on the newborn screening panel in New Jersey, much like it's not in Arizona. So when my son Shane was born in January of 2018, he had SMA, but it went undetected and undiagnosed. And he actually was totally healthy, happy and strong for the first 6 months of his life. And then at about 6 months, we started to notice some regression, which is a lot easier to see in hindsight. At the time, we were first-time parents. So there were little things like he didn't do the things he once did. He didn't move quite as much. He didn't seem quite as strong. And we started to look into why that was occurring. And we went to our pediatrician. We took him to a neurologist twice. We started physical therapy. And finally, about 5 months into our journey to discover what was happening with him, we got his diagnosis that he had SMA. And by that time, he had lost so much motor function that we were terrified as to what was happening. So thankfully, when we received the diagnosis and he was 10 and a half months of age, we were told that there was available treatment. And he did get that treatment right away, which was a series of spinal injections. And then fortunately, a gene therapy came to market called Zolgensma, which allowed him to receive a one-time, 1-hour infusion that goes right to the heart of the condition. And he got that in July 2019. So it's been a long and devastating, that word comes up again, road. But fortunately, with treatment and lots of hard work and therapy, he's regaining strength and regaining independence slowly. But we think all the time about what it would be like if it had been earlier diagnosed and earlier treated, which we know has better outcomes for these kids.
Well, and strength is certainly something that defines not only Shane, but also the entire family. Congratulations on the progress. And Doctor, in the last minute or so, give us just a little brief explanation about how Zolgensma actually works.
Zolgensma is a gene therapy that is meant to replace the gene that the patient is missing. So it replaces the SMN1 gene. It is a medication that's only meant to be given once in a patient's lifetime and is given intravenously, so in the vein, also known as IV. It is a medication that needs to be fully discussed with the patient's physician in order to minimize side effects such as liver injury that can happen. And there are ways of actually minimizing those side effects. And it is a medication that I recommend that be given as early as possible. All SMA medications should be given as early as possible because early treatment results in better outcomes.
Well, thank you both so much for the very important information, and Regina, of course, for sharing your personal story.
Thank you very much.
Thanks for the opportunity to spread the awareness.
Definitely. And stay where you are. The Morning Blend will be right back.